Okay, Jerry, you can start.
Okay, thank you. Okay, good afternoon, everyone. My name is Jerry Gosling, and I'm with COSCO, the Council of Senior Citizens Organization. I acknowledge that I live, work, and play in the lands of the Stolo Nation, namely the Sumas and Masqui First Nations. A land acknowledgement is an important opportunity to show our commitment towards reconciliation and justice for Indigenous people in the province of BC. So COSCO organization, COSCO is the Council of Senior Citizens Organization of BC. It was created in the 1950s and now has a membership of 80,000 members. We are an advocacy group and have an affiliated called the Health and Wellness Institute. We give workshops to groups free of charge and produce workshop handouts in several different languages. We currently have 48 different workshops, and the workshop today is called COSCO. And I will give you a brief overview of the organization and how it functions with the Institute. So here we have the Council of Senior Citizens Organization of BC, COSCO, representing seniors in BC since 1950. So let's have an overview of our presentation today. COSCO BC, Council of Senior Citizens Organization. About us, purpose, values, history, membership, structure, communications, committees, and networks, advocacy, education and awareness, Seniors Health and Wellness Institute, and our workshops that we give from the Institute. So what about the purpose of COSCO? We advocate, we educate, and we have campaigns. We assemble, coordinate, and advance proposals and resolutions concerned with the welfare of elder citizens and submit to government. We advance the social and welfare of all elder citizens in the province of British Columbia. What about COSCO values? We're democratic, independent, non-partisan, volunteer-driven, grassroots, respectful. We promote healthy aging, and we're a voice for all older persons, including those with low incomes. So COSCO membership, Major affiliates. Our major affiliates are BC Retired Teachers Association, BCRTA. They started in 1945. BC Government Retired Employees Association, BCGREA. They've recently had their 75th anniversary. And the BC Old Age Pensioners Organization, BC OAPO, and we've just recently had our 92nd anniversary. BC Forum, Federation of Retired Union Members, they've recently had their 25th anniversary. Members and branches from these come from all parts of the province. Each appoints a general vice president for effective liaison. We communicate through their own quarterly newsletters and websites. COSCO membership is broad-based. Affiliates include seniors groups located in all parts of the province, branches of major affiliates, senior centers and planning tables. Some are faith-based or ethno-cultural groups. Union retiree groups, including college, pension plans, and the CN pensioners. Dues are paid in relation to the number of members in each group. Associate members, we have approximately 100, and they pay $25 per year. COSCO is a member COSCO affiliations and partnerships. COSCO is a member of the Canadian Pensioners Federation, BC Health Coalition, selected partnerships and representation with ARRC, that's the Action for Reform of Residential Care, BC Community Response Networks, BC Federation of Labor, BC Poverty Reduction Coalition, and BC Therapeutic Institute. The Canadian Medication Appropriateness and Deprescribing Network, Canadian Centre for Policy Alternatives, Disability Alliance of BC, and the International Longevity Centre, also ILC, which it is known as, and the New Canadian Coalition Against Ageism. COSCO structure involves a working board. Executive board meets monthly on the first Fridays, except July and August. We have a president, a first vice president, a second vice president, and a treasurer. 4 general vice presidents for major affiliates. Membership secretary is appointed, and that currently is Linda Forsyth. Members at large, 7 past presidents. Delegates meet monthly on the second Friday, except July and August. And the committees meet regularly. Involve executive delegates and associate members. Make recommendations for executive and delegate decisions. COSCO committees consider issues and make recommendations. Policy orientated. Health, housing, income, security, transportation, strategic policy and planning. And the administration is communication, membership and fundraising, diversity and inclusion, and finance. So COSCO communicates through COSCO News. They are put out quarterly, every 3 months. COSCO Highlights, we try to put them out once a month, but sometimes it doesn't work out and it's a little late. Through our website, Facebook, monthly meetings, minutes are distributed to affiliates and associate members, webinars, and partnerships with other groups. Presence at tables at senior events, in person, or using virtual formats. Media interviews, letters to the editor, and op-eds. Ongoing actions and brief to the governments. Federal government briefs. Supporting a national pharmacare program and dental care. Supporting changes to regulations affecting drug pricing to the Patented Medicine Prices Review Board. Brief to the 2023 budget consultation. And provincial government. Provincial budget consultations, June 15th presentation. Ongoing discussions with various government ministries and officials. Energy affordability, accessibility, protection against heat domes, and accessible housing. CERB payments in GIS. New legislation passed by the federal government. COSCO key advocacy issues from our brochure. Quality healthcare systems, including pharmacare and dental care. affordable and accessible seniors housing with rent geared to incomes at 30%. Work with partners to promote safe, affordable, accessible, and efficient transportation. Support measures to achieve income security for all. And of course, we combat elder abuse. So, what is our current work? From the conference, 3 overreaching themes to guide our work. UN Declaration on the Rights of Older Persons and Ageism. Elder abuse. Social isolation and the need to improve funding for senior centers. Current issues and actions. Focus on integrated community health care with local social service program. Corporate provision of virtual care with limited or no connection to family doctor. Need for team-based care in communities. Pension protection and solvency issues with National Pensioners Federation. Letter to the Prime Minister and Senators to Bill C-228. Housing for seniors that is accessible and affordable. Safer rent allowance. So let's have a look at our recent successes. Campaign on Bill 27 regarding target benefit pension plans. Bill did not progress past second reading and died on the order paper. Advocate to BC government reconcern with mixed tenancy seniors housing. BC Housing Ministry now funding supportive housing for those with mental health and substance use issues. Ongoing advocacy on long-term care. Care hours per resident now raised to a standard of 3.36 hours per day. Pay and benefit levels more equal across the entire province. Education and awareness. Webinars on long-term care with National Pensioners Federation. Explored human rights aspects of long-term care. Webinars on provincial and federal elections for BC candidates with National Association of Federal Retirees in 2020 and 2021, with Jewish Seniors Alliance for 2021 federal election. Stay on the road workshops with ICBC, driving over 80 years. Remounting, passing the torch workshops. and those are on leadership. Ongoing communication of new and emerging issues through our website. +70 years of COSCO history. Key events in brief. 1950. COSCO was formed by employees of Canadian Pacific, Canadian National, and the BC Railway to voice the need for decent pensions. So that was the start of COSCO. 1981, registered under the Societies Act. 1991, effective campaign against Bill C-91, and that was to boost monopoly of drug companies on prescription drugs. 2003, first COSCO conference. We've also had them in 2005, 2008, 2012, 2016, 2021, and we're now looking at 2025. And planning is underway. In 2007, we had our first workshop. And the workshops are Seniors Health and Wellness Institute. 2010 to 2013, we advocated with many organizations for a seniors advocate in BC. 2014, campaign to renew the health accord between federal and provincial governments. Challenges facing COSCO. Increasing roles of well-funded organizations. United Way, CanAge, and national organizations such as HealthAge, AgeWell, and National Institute of Aging. Senior centers, planning tables are fragmented and generally underfunded. BC OAPO, the Senior Citizens Association of BC. Many receive Better Home funding from United Way. Engage BC 2019, organized through BC Care Providers. BC landscape on seniors advocacy is changing. Increasing role of United Way. Summits on aging. Organizing the community-based seniors sector. Substantial funding from our provincial government. CanAge, newly formed national organization, and it's now forming a BC chapter. More challenges facing COSCO. Developing technology skills. Communicating our message to diverse audiences. age groups, language, cultural, income, decision makers, and educational level. Also, social media and communications, completion from well-funded or competition from well-funded and well-connected organizations. Need for more core funding. Grants can be precarious. Mentoring future leaders for executive. So here we have some photos. These photos are meeting politicians, dental care, April 2022. NDP leader Jagmeet Singh roundtable. Human rights focus, UN Declaration on the Human Rights of Older Persons. Here we have our president, Leslie Gadet, with Trish McCullough, who's the president of the National Pensioners Federation. They're at Niagara Falls, the International Federation of Aging Conference, and that is November 2021. And working with Longevity Center and Margaret Gillis. Meeting politicians. Hospital parking, May 20th, 2022. Left to right, we have Barry Jones, Fred Gerling, he's with SOAR, Jerry Beggs, MLA and NDP whip, and Kay Noonan, who is also with SOAR. Here we have the Canadian Coalition Against Ageism. This is July 2022. International Longevity Center hosted meeting with UN independent expert on enjoyment of all human rights. Dr. Claudia Mailer, July 26th and 27th. And this is a breakfast meeting, July 27th, and of course to form the Canadian Coalition Against Ageism. So here we have in this photo, building relationships, and this is with Can Age, new national advocacy organization, and it's led by Laura Tamlin Watts, Strong BC Connection, and forming Can Age. And on the right is our president, Leslie Gadet. And meeting politicians, the United Way Summit. Mary Elmore, Parliamentary Secretary for Senior Services and Long-Term Care. Leslie Gadet, and Leslie's on the extreme left. Mabel Elmore is in the center, and Barb McCullough, Seniors Health and Wellness President, is on the right. Networking with Partners, United Way Summit on April 2022. Seniors Health and Wellness Institute President Barb Michalak is on the extreme left. And of course, as I said before, we offer 47 workshops, and many are virtual if you are unable to apply in person. Federal retirees, Fraser Valley West Branch, Ian Spence is in the center. And of course, our president, Leslie Cadet, is on the right of the picture. So the Seniors Health and Wellness Institute. It is an affiliate of COSCO. So we are registered under the Canada Revenue, we're registered as a charity under the Canada Revenue Agency. Separate mandate from COSCO. And we have our own institute board, and we do our own financing. COSCO board forms the members of the institute, and institute board is elected from among the COSCO executive members. So we offer free health and wellness workshops in person or via Zoom. I am vice president of the Institute. And of course, as I mentioned, Barb Michalak is the president. We have 48 workshops on healthy living, legal and financial concerns, personal planning, and safety issues, including keeping seniors safe, frauds and scams, financial literacy, care for the caregiver, dealing with stress, and dealing with conflict. So those are just some of the workshops that we have. So some of the workshops are in several different languages. They're available in Mandarin, Cantonese, Japanese, Spanish, and Punjabi. We have our brochures printed in English, French, Spanish, Farsi, Arabic, and Punjabi. So you can have your handouts that accompany our workshops printed in different languages. So that concludes the workshop for today. I'd like to thank you kindly for giving up part of your day to take in this Zoom. And remember, COSCO membership information contact is the membership secretary, and their membership at coscobc.org. And to book a workshop, www.seniorshelpingseniors.ca. So you can visit our website, www.coscobc.org, for more information. And I thank you kindly.
If anybody has any questions, they can put it in the chat or they can speak about it. Carol is saying thank you for your informative meeting. Thanks, Carol.
Okay, it looks like there's not a whole lot of questions coming forward here.
Okay, so if there are no questions, we can end the meeting.
Okay, and of course we can always you can always go to our website if you have something that comes to mind after the presentation.
Okay.
Okay, thank you.
Nice. Very informative. Thank you so much, Jerry.
Thank you.
And thanks everybody for participating. Thank you.